Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop ankle sprain pain. But before I do that, I will go over basic anatomy. Then I will go over the symptoms of ankle sprain, the causes, the risk factors, and the 3 grades of ankle sprain, and what you should do for each grade to really speed up the healing process and not having complication. Because personally, I see a lot of patients have a lot of complication from ankle sprain because they use modality that's not effective and actually make things worse, that the rehab time takes longer. So first, ankle sprain, it usually is sprain in the ligament. So basically, ligament is the tissue that attach bone to bone. That's a basic definition for the ligaments. It's a fiber tissue that attach bone to bone, and that's happened with the ankle sprain. You have a ligament sprain, which is a tear in that fibrotic tissue. So it's more common to have inversion injury or lateral sprain from the inversion. So when we look at the foot bone and anatomy, you will notice here the small bone here. This is a fibula, and this is a tibia, and that's the big toe here. So the most common ankle sprain is inversion sprain, which means your feet is twisted inward. So when that happens, it's not moving here, but usually bending this way, or your feet bending upward this way. So it puts stress on the ligament on the lateral side, the outside here. And that's the most common type of ankle sprain. So, and you can see here, there is a lot of ligament that stabilize those bones, keep those bones together from being unstable. And that's with ankle sprain, you start to have issue with those ligament, tear in those ligaments. You will have instability, swelling, redness, and pain with the weight bearing. Most common sprain is the lateral side of your ankle, and the most common ligament sprain is the ATFL, CFL, and PTFL, which is the anterior talofibula ligament. So this is, as we said, the fibula and the tibia. So the anterior talofibula ligament that's actually attached the tibia to the fibula. And also the other common one is the calcaneofibula ligament. This is a calcaneal to bone, and this is a fibula. So the ligament that attach both of them, those are common to be sprained. And the third one is the posterior talofibula ligament. Those are the most common sprain ligament in the ankle. The least common sprain is the deltoid ligament, which is the inside of your ankle, and you can see it here in this image. It's a deltoid. It's look like there is a delta kind of shape on the inside. And this is less common because usually with this type of sprain, your ankle going outward, that's pulling on this area and sprain this ligament. But that's a less common. So what kind of symptoms you might have when you have ankle sprain? Well, you're gonna have pain with weight bearing. So when you put weight on your feet, you start feeling pain. A lot of the time you will have a lot of bruising, a lot of like swelling around this area, instability, weaknesses, tender to touch, and so those are the common symptoms of ankle sprain. So what could cause it? Well, one of the common causes is bad shoes that actually not supporting your feet and actually cause your leg to twist more inward, outward. That's common. The other common issue is muscle tightness, especially when you have calf muscle, which is a muscle attached in the back of your leg. Calf muscle tightness, it's gonna cause issue with your ankle stability, and it could lead to ankle sprain. The peroneus muscles that's attached to the outside of your leg, it actually could be tight, and that increases the risk factor for having this issue. Twisting with the sports like running, basketball, tennis, any sport that lead to twisting with the ankle, that's another risk factor. So what are the grades and how to address each grade? So I'm gonna go over the grades briefly here, and then when I go over the healing cycle, we'll address what we should do for each grade of sprain to really speed up the healing process, to not having complication, because it's very common to have complication if you don't do the right thing. And if you use a lot of modalities that I will go over that using traditional medical model, things will not gonna go very fast and might have more complication, and we'll understand why based on understanding the normal anatomy. So grade 1 sprain, and you can see it here in this image, it's basically micro tear, very minor tears, and you start to have some inflammation with that, some pain and tenderness, and usually if everything goes as perfect with the approach that I will go over with you in this video, it should take 2-3 weeks max. Grade 2 sprain, you will have a bigger tear, which they call it partial tear, and you start to have moderate inflammation. So the swelling is start to be more, the pain gonna be more, and that's take 4 to 6 weeks in perfect scenario. Grade 3 sprain, that is complete tear, and it's actually totally separation of the ligament, and that causes instability, and you will see a lot of swelling with that. So there is a lot of swelling with that instability. You will not be able to put too much weight on your ankle for grade 3. You can see here in this image, this is a grade 2 sprain, and compare this to grade 3, and you can see more swelling, discolorization, edema, and purplish colors here. That's from the sprain. That's a grade 3, and that's usually you will have a total tear like here of the ligament. Grade 2, you will have partial tear, but you still have some swelling. Grade 1, you will have a micro tear, like really minor tears. You can see it here like dots in ligament, and you can see in this image the severe the grade, the more swelling, so the more inflammation that gonna be involved, and that will make things more complicated if we don't get the inflammation under control. Here's the key with ankle sprain: if you don't know how to get the inflammation under control, things gonna get worse. And I will show you what's been used that's not working very well for inflammation, and we're gonna go over what's working very well for inflammation, so hopefully you can get that under control. And I personally had several patients that with different grade 2 and grade 1 and 3, when we start with the proper inflammation protocol, things was moving very fast. Okay, so how to treat the ankle sprain? So as I mentioned to you, we need to really address it based on the healing cycle. So briefly, I'm gonna go over the normal healing cycle here and relate it to the ankle sprain, so you can visualize what happened internally. Your body has to go through 3 stages in order to heal. You can see the first stage here is inflammation. On this image, swelling, redness, the blood start to rush to that area. Second stage of healing is a scar tissue stage, or the proliferation stage. Your body has to build a scar tissue here. If our body does not build a scar tissue, it's open wound susceptible for infection. And period. If your body does not build the scar tissue, your ankle sprain will never heal. Never. Impossible to heal. Scar tissue is the glue that the body builds up to adhere or to stick the tissue that torn. You need a scar tissue. You have to have a scar tissue. Scar tissue is essential part of our survival. If our body does not build a scar tissue and you have external cut, it will never close. So we need a scar tissue. The problem is when we have too much scar tissue, because our muscle should act like a rubber band. When you contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in the rubber band, and your muscle will not stretch much, and that's limit your range of motion, cause a lot of issue. And already risk factor for ankle sprain is muscle tightness, and usually that happen from a lot of scar tissue, a lot of fascia restrictions in the calf and peroneus muscle. The calf, the back of the leg muscle, and the side, the peroneus muscle is the lateral, the side muscles that attach to the leg. A lot of tightness, a lot of scar tissue on those areas that cause instability, imbalance in the ankle, that increase the risk of ankle sprain. That's usually from a lot of scar tissue and issue with the proliferation stage before actually having the ankle sprain issue. Perfect scenario, during the maturation stage, your body should get rid of the scar tissue, resolve everything including the inflammation. So for ankle sprain, as you can see here, when you start with the grade 1, you have a mild inflammation. It's not too bad. When you have grade 2, it's moderate inflammation. Grade 3 is actually very severe inflammation. So we have to be aggressive on addressing the inflammation. I'm gonna go over what commonly used for ankle sprain that does not work very well based on understanding of the problem and based on research. So what they've been using, and I personally used after graduate from physical therapy school, heat, ice, and steam. Based on a study, it provides temporary pain relief. When we look at the inflammation, and ice is not gonna really do much of decreasing the inflammation. There is nothing can be done with the ice and steam to really break the scar tissue, release the fascial restriction, especially in the leg muscles. Think about this way: you have ankle sprain, but we cannot only look at the ankle without addressing the calf muscle and the peroneus muscle. If you ignore that, you're really not treating the whole area because they are connected. So when we look here at this model, so your calf muscle in the back of behind your knee started and going on your leg and all the way and attach with the tendon, attach all the way to your toes. So if you have any tightness here, it's gonna cause a lot of pulling instability in the ankle. So that's a big important muscle that we have to address. There is usually with those patients a lot of scar tissue, fascial restriction in the calf muscles. The other issue is the peroneus muscle that's in the outside of your leg and attached to the fibula, the outside bone, and going all the way to your toes. And if there's any tightness, it's gonna cause imbalance and issues in the ankle. So we cannot look only in the ankle sprain and those muscle keep pulling, not giving enough room for things to heal. This is all connected, and that's extremely one of the things that overlooked by a lot of healthcare providers. They just focus here, oh, ankle sprain will give you boot, and not worry about any structure here that attach it to here that make things worse and more complicated. The other thing is use massage and foam roller, and if you have inflammation here, you start to massage. That's not gonna make improvement. That's actually will make it worse, because if you rub against inflamed area, you're gonna inflame it more. The other problem is, and that's why massage and foam roller are not effective, when you look at the thickness of the calf muscle, some people, their calf like about 2-inch thickness. It's impossible with the massage and the foam roller to do deep release, because in massage we learn in school to use the knuckle or your elbow to go deep, to do deep release, and that's impossible to do it mechanically with the hand. So you will not be able to do that. We have to have a tool to really go deep enough to really do the deep release, so the muscle will be loose, so it decreases the stress on the ankle. The other thing they've been used, stretching. If you're gonna stretch with the ankle sprain, you're gonna sprain it more. Think about this way: if you have, and you already have ankle sprain, if you're watching this video, or someone relative has an ankle sprain, that's mean there is a tear. So if you stretch it, what's gonna happen? You're gonna tear it more. That's why in general I don't recommend any stretching for my patient for any condition. There is other safe alternative option than stretching. Don't stretch no matter what, and I have other video on why you should not ever stretch. So the other thing that's been used is exercises, but if you are in inflamed stage, grade 1, grade 2, grade 3, and you exercise, you're gonna inflame it more. We do not introduce the exercises unless the inflammation went down, get under control, releasing all the tightness. Then that's a good time to do some exercises, not the other way around. That's premature and that's going to make things worse. So what should we do to really get to the root cause of the problem? Well, we have to be aggressive with the inflammation. So if a grade 1 inflammation, I usually use the Magna Heal. That's actually very effective. The magnetic length about 3 inches that can penetrate the body, and that help with inflammation. Very effective tool to decrease inflammation. The other thing, I put my patient on anti-inflammatory diet. And for the patient that's on grade 2 and 3, we have to be very, very aggressive to address the inflammation, because as you see visually, you can see a lot of swelling. So what I personally do is I have the patient sleep with the magnet. They put it in a sock on the ankle, and I have other video actually for real patient that they put the magnet on their sock, and in a matter of 1 day they woke up in the morning and they noticed the swelling almost gone. So there's several patients reported that. So that's what I personally recommend for my patient. Put it in your ankle, put it in your sock, sleep with it. If you have more inflammation, you will need more time with the Magna Heal. But when you start to have more complication like grade 3, we need to be aggressive of decreasing the inflammation. That's why I have an option for those patients that have severe inflammation to use certain supplements to decrease those inflammation and swelling, and that is internally working on decreasing the inflammation, externally working with the Magna Heal. That's a very important, especially for grade 3, and those what I personally use certain type of collagen, magnesium, and other vitamin and supplement to make sure the body work its best to really speed up the healing cycle. Otherwise, the grade 3, it's reported 3 months at least. But if we do the right thing, things could be improving and get it better sooner. Okay, so that's for inflammation. The other thing we need to work on is the proliferation. Especially as I mentioned to you, we have to work on the calf muscle. We have to work on the paranoid muscle. Even if you have the grade 2, 1, 2, or 3, I usually with especially grade 3, I focus on working on the inflammation on the ankle area and working on the proliferation on the calf muscles. So what I do for breaking the scar tissue, I use the A3 to release superficial scar tissue, and I use the A5 for the calf, the paranoid muscle, to really go deep and work on breaking the deep scar tissue, deep fascia restriction, and trigger point. The other thing that's very overlooked in the proliferation stage is the fascia system. And briefly, I'm gonna go over that because that's an extremely important part of treating the ankle sprain. So the fascia system is, the superficial layer is like a wraps around the entire body. It's like a Spider-Man suit. So you can see it here in the image, the white tissue is a fascia system. So that's a superficial layer. To make things complicated, there is 2 big categories, superficial and deep layer, and the deep layer is divided to 4 subcategories. But don't worry, the treatment is very simple. But I want you to appreciate the complexity of the system, the fascia system, because it will make a lot of sense why massage and foam roller are not effective to treat any musculoskeletal pain in general, not just ankle sprain. Because mechanically impossible with the foam roller or the massage to go deep in the fascia system to do mechanical force. Because think about this way, if you have deep scar tissue, deep fascia restrictions, it's like your car, you want to unscrew a screw that's in the motor, but the screwdriver you have is very short. It's impossible mechanically to really unscrew the screw. You need to have a long enough screwdriver to go deep to do the release. The same thing for scar tissue, for fascia restriction. If you cannot exert mechanical force on the restricted tissue, it's impossible to release it. That's why massage and foam roller do not work. Okay, so the superficial layer, to make things more complicated, each of these layers has 1 to 2 subcategories, layers on the top of each other. So we have the superficial layer and the deep layer divided to 4 deep layers. The first layer is the apparatic fascia. It wraps a group of muscle, then the epimysin, the premiysin, the endomysin. Epimysin wrapping each individual muscle fiber. Then we have the premiysin wrapping a bundle of fibers, and then at the end the endomysin wrapping each individual fiber. And you can see here the epimysin wrapping the muscle. Then you have the premiysin that wrapping a bundle of fibers. Then each individual fiber is wrapped with the endomysin. That's why it's impossible mechanically to release it with the massage or foam roller, especially in the calf muscle. You need to really go deep enough to release the scar tissue. And I want you, if you are at home now, just palpate your calf. If you start to feel nod, that's probably scar tissue. If you start to feel a band, that's a fascia restriction. And if you cannot go deep enough to exert mechanical force on the restricted area, it's impossible to release it. So what I personally do is I use the A1 to release the superficial fascia layer, the apparatic fascia layer, and then I use the A5 to release the apparatic fascia, epimysin, premiysin, and endomysin. That can go deep. For some patient, 2 inches, 2.5 inches, we can do a deep release. So we have to work on the proliferation stage while you are on all of these grades in your calf muscle, as long as everything pain-free. Sometimes with grade 3, we'll postpone the working on the calf until the inflammation gets under control on the foot. But eventually we have to work on both ends of the healing cycle, the proliferation and the inflammation stage. But for ankle sprain, the first initial act is being aggressive with the inflammation. The shorter the time the swelling gonna go down, the faster the recovery. If you have chronic inflammation, that chronic inflammation gonna cause irritation to the tissue, slow down the healing, and you're gonna have more stiffness, more scar tissue, more complication. So we have to be aggressive with the inflammation. So what you should do at home, it's based on the grade, which grade that you are in. The grade 1, grade 2, we're gonna be, and grade 3, you have to be aggressive with the inflammation. Grade 3 gonna take a little bit longer time. Grade 1 and 2, if we work immediately on the inflammation, and while there is no pain, working on the proliferation stage, on the calf, on the peroneus muscles, things will move a little bit faster than what usually everybody's saying. So first, you need to avoid any sports. If you have ankle sprain, you don't want to do any sports because you're going to make it worse. The other thing, you have to release the tight muscle. There is always muscle tightness in the leg. This is not something, an option for someone who has ankle sprain, because there is usually muscle tightness. We have to do gait training, and I usually do that only when the inflammation goes down, all the tightness goes down, and then I teach the patient how to walk the right way. We have to release the tightness, and remember, one of the big risk factor is actually muscle tightness. That increases the risk of having ankle sprain. We have to wear the proper right shoes. I will avoid any high heels in general. And we need to correct anatomy. A lot of those patients might have a really high arch or pronated foot, and I have certain exercises to work with patient to correct that arch. Most of the patients respond very well to that. So that actually concludes how to address ankle sprain. So if you have any question or comment, leave it in the comment section below and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.